Why seniors wake up at 3 a.m. Doctors explain what it means. Hello and welcome. If you are a senior who keeps waking up around 3 a.m., or you care for someone who does, this video is very important. Many older adults believe waking up at 3 a.m. means something is seriously wrong. Others think it is just normal aging. Doctors say the truth is more nuanced. Waking up at 3 a.m. is very common among seniors, but it is not random. In most cases, it is your body sending signals about sleep cycles, hormones, digestion, stress, or underlying health changes. Today, doctors explain why seniors often wake up at 3 a.m. and what it really means for your health and sleep. Most importantly, we will discuss what is normal, what deserves attention, and what you can gently improve. Let's begin. Part 1. How sleep changes with age. Doctors explain that sleep architecture changes naturally as we age. After age 60, sleep becomes lighter, shorter, and more fragmented. Deep sleep decreases, and the body spends more time in light sleep stages. This means seniors wake up more easily from sounds, thoughts, temperature changes, or internal body signals. Around 3 a.m., the body naturally transitions between sleep cycles. For seniors, this transition often causes awakening. This alone does not indicate disease. It indicates normal age-related sleep sensitivity. Part 2. Melatonin decline and the 3 a.m. effect. Doctors explain that melatonin is the hormone that regulates sleep. Doctors explain that melatonin production declines with age. In younger adults, melatonin stays high throughout the night. In seniors, melatonin often drops earlier, usually around 2:30 to 3:30 a.m. When melatonin falls, sleep becomes lighter, the brain becomes more alert, and awakening becomes easier. This is one of the most common medical explanations for 3 a.m. wake-ups in seniors. It does not mean insomnia. It means the sleep hormone cycle has shifted. Part 3. Blood sugar fluctuations at night. Doctors pay close attention to nighttime blood sugar in seniors. Around 3 a.m., blood sugar may drop or spike. This is especially common in people with pre-diabetes, diabetes, or insulin resistance. When blood sugar changes, the body releases stress hormones like cortisol and adrenaline. These hormones wake the brain. Symptoms may include sudden awakening, light sweating, racing thoughts, and restlessness. Doctors note that many seniors wake at 3 a.m. without realizing blood sugar is involved. Balanced evening meals and avoiding late sugar spikes often reduce these awakenings. Part 4. Cortisol, the stress hormone. Cortisol is the body's alertness hormone. In healthy sleep cycles, cortisol rises in the morning. In many seniors, cortisol rises too early. Doctors observe that cortisol may begin increasing around 3 a.m. This can be triggered by chronic stress, anxiety, poor sleep habits, or inflammation. When cortisol rises early, the brain enters a semi-awake state. This creates the familiar pattern: waking at 3 a.m., difficulty falling back to sleep, and active thinking. This does not mean weakness. It means the stress-sleep balance needs gentle adjustment. Part 5. Digestion and the liver at night. Doctors explain something many seniors do not realize. The digestive system and liver are very active between 1 a.m. and 4 a.m. Heavy or late meals can interfere with this process. Common triggers include late dinners, fatty foods, alcohol, and spicy meals. When digestion struggles, the nervous system activates. This can wake you around 3 a.m. Doctors often recommend earlier dinners, lighter evening meals, and avoiding alcohol at night. Many seniors notice improvement within days. Part 6. Prostate, bladder, and night awakening. Doctors say this clearly. Not all 3 a.m. wake-ups start in the brain. For many seniors, the bladder triggers awakening. As we age, bladder capacity decreases and nighttime urine production increases. Men with prostate enlargement and women with pelvic changes often wake around the same time each night. Once awake, returning to sleep may be difficult. Doctors emphasize that the bladder may wake you, but the mind keeps you awake. This distinction is important. Part 7. Emotional processing during quiet hours. Doctors and sleep specialists observe that the brain processes emotions differently at night. At 3 a.m., the environment is silent, distractions are gone, the mind turns inward. Unresolved thoughts, worries, or memories often surface during this time. This is common in seniors who reflect more deeply on life experiences. This does not indicate depression by default. It indicates mental activity without daytime filters. Gentle breathing, reassurance, and routine help calm the mind during these awakenings. When 3 a.m. wake-ups are normal. Doctors say 3 a.m. wake-ups are usually normal if you fall asleep easily, you wake up calmly, you feel rested overall, you can nap lightly if needed. Occasional awakenings are part of aging. The goal is not perfect sleep. The goal is restorative sleep. When to pay attention. Doctors recommend medical evaluation if you wake up gasping for air, you experience chest pain at night, you sweat excessively at night, you feel exhausted every day, and you notice sudden weight or mood changes. These may indicate sleep apnea, heart issues, or metabolic problems. Most 3 a.m. wake-ups are harmless, but patterns matter. What doctors recommend for better sleep? Doctors suggest gentle, realistic strategies. Maintain a consistent sleep schedule, eat dinner earlier, limit evening sugar and alcohol, expose yourself to morning sunlight, reduce nighttime screen use, and practice calm breathing if awakened. Do not fight wake-ups. Guide yourself back to rest. Final message. Waking up at 3 a.m. does not mean something is wrong. For most seniors, it reflects normal changes in hormones, sleep cycles, digestion, and stress regulation. Your body is communicating, not failing. Understanding these signals removes fear and restores confidence. Sleep after 60 is different, not broken. Outro. Thank you for watching. If this video helped you understand your sleep better, please like, subscribe, and share it with someone who wakes up at 3 a.m. and wonders why. Rest well, listen to your body, and take care.